Hey, Dr. Vince Gutierrez here, physical therapist. You can find me at movementthinker.org. I really think I am going to hammer this position into the ground. This is probably the third video that I'm creating for this one small movement. I'm getting questions about how to progress this movement, how to perform this movement, and so I'm going to cover it again and again and again until people understand what the movement looks like, how to make it easier, scaling it back, how to make it harder, progressing it. One of the ways that you could progress it was that bench press setup video that I did previously. Okay? The movement that we're looking at, pulling your shoulder blades back. It's called scapular retraction, and it's just working the muscles between the shoulder blades and moving the shoulder blades into a... Again, this position is very helpful if the patient is having trouble with raising their arms. There's some research out there by Jeremy Lewis to show that scapular position, when changed, can affect raising your arms overhead or pain with elevation. And so learning how to move your shoulder blade independent of everything else is very important. One, it's called motor control, and you should be able to move your body through space without too many limitations. So the first way that you can do this is literally pull your shoulder blades back and let them go. Pull your shoulder blades back and let them go. This exercise does not get you stronger. This is just teaching you positions, because when we look at getting stronger, you need to have some sort of resistance against the movement. The movement essentially has to be harder than with no resistance, right? And that's how you get stronger over the course of time. And when you're doing it in this position, your resistance is gravity. Gravity is pushing you down. You don't have any resistance going forward or backwards, okay? You're doing this against the friction of air, okay? So there's your resistance. Or tight muscles. If you have some tight muscles restricting this, that would be your resistance. But you don't have resistance from gravity or weight challenging this version of the exercise. In order to create more of a challenge, you have to work against gravity. Remember, it sounds simple, and I'm going to say it and you're going to be like, duh. Gravity is always trying to push you down. Gravity is always trying to push you towards the ground. And so if I change my position to where I'm leaning forward, now gravity is trying to push my shoulder blades towards the ground, and if I pull my shoulder blades back, there's a little bit of resistance against gravity. I'm a meathead from the 1990s, right? And so, I grew up reading these Powerlifting USA, strength magazines, Muscle and Fitness, Flex, Iron Mind, books. I used to love doing this stuff, right? And there was one thing that stuck with me through all of these years. When you're performing an exercise against gravity, typically the muscle that is facing the ceiling or the sky is the muscle working. So if I'm in this position, the muscles that are on top of my shoulder are the muscles that would be working against gravity. The muscles on the front or back aren't doing a lot of work against gravity. If I lean forward a little bit, now the muscles up here are working against gravity. Okay? The muscles here are working against gravity. And so if I just pull my shoulders together in this position, I'm working against gravity, but I'm not working a lot against gravity. It's similar to doing a push-up from a countertop versus a push-up from the floor. Gravity is not going to affect that as much when you're so elevated. And so when I'm elevated in this position, it's harder for those muscles than in this position, but it's not as hard as if I'm lying down flat. To increase the resistance from gravity for these scapular retractors, you would have to go even further forward. And so now I'm more against gravity as I pull back and return. I have a lot of people that are concerned about forward bending. I'm not going to tell you that you should bend. I'm not going to tell you that you shouldn't bend because I haven't seen you as a patient, right? So I'm not going to give the advice of, yes, it's safe for everybody, or too broad of a statement. But one of the ways that you can support yourself is literally putting a hand down. You create a triangle in your hand so you have a very wide base of support, so it helps your balance, and it takes some of the load off by sharing the load with your arm. And you can get to the same position by doing this. And so I'm working more against gravity than if I'm up here, Okay? One of the ways to make this exercise harder still, and you're fully supported, is to do it on a table. And so I like to use the towel just because it's more comfortable. And from this position here, you're literally just pulling your shoulder blades back and then relax. One of the things that we tend to see happen is people have trouble understanding where their body's at in space. And so when I say pull your shoulder blades together, they do this, right? They just pull their shoulder blades towards their ears because it's the only motion that their body is familiar with. And so for that, we give cues such as, imagine there's a pencil between your shoulder blades and you're trying to squeeze the pencil between your shoulder blades. The other cue that we would give is to try to put your shoulder blades in your opposite back pockets. So instead of looking like this, it looks like this plus that. This is a much harder version of doing this than the standing up version or the leaning forward version. And I know many patients that just can't get to this position. So practice the one that is best for you, that you're able to do the movement correctly, and then make your progressions as you're able based off of what we covered before in the sets and reps scheme video. Thanks for watching.